Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Regardless of who you are, it's frightening to be told you have cancer. The word alone turns your world upside down, and you have a million questions about where to turn next for answers and for help. Now Virginia has a new cancer clinic, the multidisciplinary Metastatic Cancer Clinic at Johnston-Willis Hospital. And joining us on First at 4 today is Dr. Danna Johnson, Director of Pathology at the clinic. Talk a little about your role at the clinic.
I'm a pathologist and the director of pathology for the Thomas Johns Cancer Hospital. And what a pathologist does is basically assess various tissues and specimens that patients may have performed on them, biopsies and so on. So I would be basically the person who first diagnoses cancer, and recently we've gotten more into the areas of personalized medicine and genomic testing, things of that nature.
After the diagnosis of cancer comes the treatment. What types of services can patients expect here at this clinic?
Well, we deal specifically with patients with metastatic cancer. That is, patients who have cancer that developed at one space but which has then spread elsewhere in the body. Very often these patients have received all sorts of different treatment. They may have had surgery, radiation therapy, chemotherapy, and so on, and they are either referred to our clinic by their physicians because they've developed problems. Either their cancer has stopped responding, or they can self-refer if they just want a second opinion about what to do.
Now, we are just now hearing about this cancer clinic, but it's been in the making for some time. Talk about that.
Yes. Well, it took us over a year actually to just set the parameters, invite the various members, get everyone on board, and develop the framework for this clinic. But we actually started it last fall. It meets every other week on a Tuesday morning, and it's been a great success so far. What
void is this clinic filling in the Virginia area? There are a number of other clinics.
Yes.
What void is this one filling?
Oh, that's a very excellent question. This is actually a totally innovative program for our area, and in fact in the country. There are, as you say, a lot of different clinics that deal with, for example, breast cancer or lung cancer. We have one for brain cancer at Johnston-Willis. But what this does is it deals with patients who have metastatic cancer. It doesn't matter where their cancer started. But
specifically focused.
Yes,
all right.
Yes, and often these people have kind of fallen through the cracks, or they've received a lot of treatments already, and it's just a way to reassess, assess some of the complications they may have.
Dr. Johnson, thank you so much for coming in and talking with us on First at 4.